All right, so it's about a minute after, and I think we should get going. So welcome everybody to the National Single Payer Working Group, where the joy of organizing happens. My name is Judy Albert, and I'm videoing in from the state of Vermont. National Single Payer is a national grassroots organization that organizes locally in the struggle for national single payer healthcare. We are united by the common principles that healthcare is a human right, must be free from corporate profit, and must be achieved through national legislation. A couple of housekeeping. Please introduce yourself in the chat with your name and your city, but try to keep chat conversations to a minimum. Thank you for joining us today. At our last working group meeting, which was June 11th, we debriefed the National Day of Action. We had many activists who were able to talk about their actions, and there was a good deal of excitement sort of coming off the high of all of the work that went into that day. We also began the discussion about next steps, which is very vital. And tonight, we're hoping that we can expand on that discussion, explain some of the ideas that we had, and listen to ideas that you all will bring to us. We're going to be introducing 4 ideas that we've been thinking about as campaigns to use to build the movement necessary to put single payer on the nation's agenda. After the discussion, we'll take comments from the audience. If you would raise your hand, you'll be called on in the order that you raised your hand. Be patient with us. Sometimes we can't always see the hand signal raised, but we will do our best to keep up with it. We'll also be dropping links in the chat that tell you how to donate, how to sign up for the newsletter and the emails, and about when our meetings are in the future. So at this point, Anna is going to explain some of these new movement ideas.
Great. Thank you. Thank you, Judy, and welcome everybody to National Single Payer. We do say that this is where the joy of organizing happens. So hopefully that's the case. I had a lot of fun organizing and participating in the National Day of Action. So I hope that many of you did as well. So what we're going to be talking about today is how we grow this movement. As everyone knows, more than 140 organizations endorsed the National Day of Action. We had actions in at least 31 cities across the country. And so how do we bring together all of this new energy and grow the movement of these new activists and new organizations? And so Judy, Kay, and I are going to be talking about these 4 ideas. And then please keep your questions until after we do the presentations, and then go ahead and raise your hand and we'll be happy to call on you, because we want to share these ideas with you, but we also want to know what you're thinking as well. So I'm going to start talking about something that we're calling the SOS campaign. And SOS stands for special order speeches, but it isn't just special order speeches. And then Judy is going to be talking about another part of the campaign, which is the slideshow. And then Kay is going to be talking about then I guess I go back and talk about the state resolutions, and Kay is going to talk about the rural hospital campaign. So that's kind of the outline of what we're going to be doing tonight. And then after that should take about 30 minutes or so. And then hopefully after that, everybody will have an opportunity to let us know what your ideas are for growing this movement. So the SOS campaign, as I said, stands for Special Order for Single Payer. And that aims to mobilize our congresspersons and our senators to make a publicly visible fight to put single payer free from profit on the nation's agenda. So this movement must work with our elected officials, particularly those who have endorsed Jayapal's Medicare for All legislation, to do more than just put their name on a bill, knowing very well that what they believe is that it's not going to go anywhere. So we want to work with them and mobilize them to do more than just endorse this bill. We want them to speak out, to display, to discuss, to write, talk, and then finally improve the legislation. So what are special orders? And some of you might know more about special orders than I do. I'm very late to this, and I'm just finding out about them. But special order speeches are also called special orders, usually take place at the end of the congressional day. And during this special order period, members of Congress can give speeches of anywhere from 5 to 60 minutes on a topic of their choice. And they are delivered on the House floor and reach a much larger audience because they're televised on C-SPAN, and they go into the congressional record. So what we are asking our representatives to do is, after they endorse Jayapal's bill, is to request a special order speech so that they can talk about the importance of Medicare for all and to put this on the public record. So that's the first thing. It's not just about special orders, but it's also about displaying their support for Medicare for all prominently in their websites. Every single senator, every single congressperson has a website that we're probably paying for. And, I can just drop links as to how you find your representative's web page. I'm sure everybody knows how to do that. But you can ask them to display their support for national single payer, Medicare for all, free from profit prominently on their website. And they should also include education about single payer. So yes, display it prominently. Have a page that is dedicated to single payer, and then to add a section on why I support single payer, why they support single payer. Then we want them to talk about this during their town halls. I know that fewer and fewer members of Congress and senators are actually having town halls, but when they do have a town hall, show up at them and ask them to put it on the agenda, to put single payer on the agenda. And if it's not on the agenda, bring it up. Also, they have newsletters and emails that they send to their constituents. Ask them, urge them, demand that they include single payer and those missives, communications as well. And they have a much, much larger platform than us mere mortals. And so we want them to use that amazing opportunity to talk about it in hearings, in the media, and at all public opportunities. So the last thing that I want to talk about is that we also want to talk with them about improving Medicare for all. Even though Jayapal's bill, if it were passed tomorrow, and it would be light years better than what we have today. But there are some things that really do need to be improved upon. And these are elements that were included in HR 676 as Conyers bill that were dropped from the current Medicare for all legislation. And we do believe that the bill needs to be improved. And so we want to speak with our congresspeople about the improvements, and so that they can talk about how Medicare for all needs to be improved. And that's going to be another webinar that we're going to be holding, and that's on the model bill. So Becky, our communications director, is working really, really hard on two new pages. One is the SOS campaign on our website, as well as the model bill. And these will be up and running hopefully in the next week or so that people will be able to go to our website and download all the information that they need for the SOS campaign, as well as for the model bill. So one of the things that she's going to be including in the website on the SOS campaign is something that we're calling a checklist for Congress. And I'm going to share my screen with you right now. Hold on for me 1 minute. See if I can pull this up. Hold on a minute. Okay. Yeah, here we go. Let me share my screen and I'll show you what the congressional checklist looks like. And this is going to be available on our website. So can people see that? I hope. This is a checklist that you can use to mobilize your congressperson and your senators to make a publicly visible fight to put national single payer healthcare free from profit on the nation's agenda. They can speak out about it in a special order speech on the floor of Congress. And this explains to you what special order speeches are. And then you can check that off when that's completed. They can display it prominently on their website. They can discuss it at town halls. They can write about it in emails, newsletters to their constituents. They can talk about it in hearings, media, and in all public opportunities. And then finally, to improve the Medicare for All bill and become a champion for the model bill. So that's what the congressional checklist looks like, and that's going to be available for people to download and then to use with their own member of Congress. So that's what we're asking people, is to schedule times with their member of Congress and go over this checklist. So I think that's all that I have on special order speeches. And if people have questions, please save them. And I'll be happy to answer what I can. Judy, do you want to talk about the slideshow?
Sure. One of the other things that we thought about doing was to put together a public shareable PowerPoint slide set that anybody can use. You can download it from the website, and we don't have it put together yet. Partly because one of the things that we would like to hear is feedback from our activists as to what they think would be useful based on what what they think their local audience might be looking for, what type of organization that you may represent, and therefore the type of groups that you may be speaking to. We've certainly done any number of slide presentations that have been relatively data and statistics heavy from the standpoint of health policy, and some of us who are physicians have a certain perspective. And sometimes I think the message is a little bit less powerful when there's too much information that's technical. So understanding that so many of the organizations that participated in the Day of Action were not specifically healthcare organizations, we thought it could be useful to use the input of those activists and help with putting together some slides. Some of the things that I think would be worth covering, probably the thing that has come up multiple times in some of the the working group meetings leading up to the National Day of Action had to do with talking points about whether we support state single payer or national single payer. And I think it's pretty clear that we are a group that supports national single payer because that's the name of our group. But there are certain reasons for that might not be immediately obvious to everybody. And while we are not interested in antagonizing groups that support state single payer, we would like to make our position clear on that. And so we think we can provide some useful information and clear up, hopefully, confusion about that. The extent of privatization of all of healthcare is something else that I think would be useful for people to have a handle on. I think most people are getting more and more aware of that. And of course, that was part of the outrage that happened with the shooting in the aftermath of the shooting of the CEO of United Healthcare. Everybody knows that insurance is overly involved in healthcare, but I think the extent that private corporations, private equity, other investors are involved at many other levels is perhaps something everybody is not so aware of. So we've talked about don't hand Medicare to Wall Street before, and we think we can help illuminate that in some slides. you know, obviously with the big beautiful bill that the current administration is getting ready to pass is going to devastate many uh, current recipients of Medicare by making it harder to stay on Medicare with work requirements and everything else. And while we don't necessarily want to spend time just getting into a fight about what's in the bill, I think that understanding how Medicaid is not meeting people's needs even before these cuts go into effect is something that we would like to help people understand and help activists present, because even though there are many states where Medicaid recipients are relatively happy with their Medicaid, I might have said Medicare, Medicaid is also increasingly privatized. And it still is a system that requires means testing, requires that you prove that you're worthy by being poor enough, and requires that you continually do that in order to stay in the program. And we don't think that's a good system, and I don't think anybody would vote for that. Um, so those were some of the ideas I thought would be useful. You may have some completely different ones that we haven't thought of, and we could help in researching some of those. But that would be a starting point. So Anna's going to talk a little bit more now about another campaign, the state resolution campaign.
So in addition to the special orders speeches, to the slideshow, we are thinking of having state resolutions. So for individuals who feel that they could work with their state legislatures could pass resolutions in their states that puts the state on record supporting the Medicare for All Act, and ask that their congressional delegation also sign on to the Medicare for All bill. Now, in just to give you an example, in California in 2022, we were successful in passing a resolution to that put California on record opposing ACO REACH, as well as the privatization of Medicare. And right now, there is another resolution in California that urges the California congressional delegation to oppose cuts to Medicaid and Social Security. Now, resolutions are non-binding, at least in California. They are a little bit certainly easier to pass than legislation because they do not need to be signed by the governor. I'm not sure what other states' rules are, but at least in California, and in other states, they really, even if they're non-binding, they could act as great educational and organizational tools for constituents and their legislators. So that's something else that we're thinking about, encouraging people to pass resolutions at their state level to support the Medicare for All bill. And then I think Kay is going to talk to us about our last campaign, and that's the rural hospital campaign. And I can share, tell me when you want me to share the slide.
Your slides relate to the rural?
Yes, it doesn't, yes, it just is the number of hospitals that are at risk of being shuttered in every state, in each state.
All right, thank you, Anna and Judy. Being from Kentucky, you know, we look at our state and we see that we have the congressperson from Louisville is a supporter of national single payer and is signed on to the national bill. And the other 5 in the rural districts have done nothing. And yet the contradiction is that the rural areas of our state are the most endangered by the lack of health care. And I think that's true across the countries, both in, African American and as well as white communities, that the life expectancy is lower among rural communities. And we've seen it now with the projections that the Medicaid cuts in the big, beautiful bill are projected to close 338 rural hospitals, leaving many of our rural communities devastated. So what is the reason why the people that are hurt so badly by a failing healthcare system are not the ones that are up in arms to demand that we go to a single payer healthcare system? So that's the proposal, is that we try to change that disconnection. We tried to do it earlier when we worked with the people in Wisconsin, and found that the people of Dunn County, which was a rural area, actually did vote in their majority for a Medicare for All system. So we'd like to try to find the ways to connect the deep desire and intense feeling that people in rural areas have to protect their community hospital with the single payer system that would actually do that, because the single payer system provides the infrastructure and guarantees that there are hospitals available, clinics, et cetera, physicians in all of the areas of the country. So that's the idea. Can we connect it? And we're looking for the articles and the studies and the ways to think about how we do that outreach into those communities. Can we talk to the county and city officials in those rural areas that are in danger of losing their hospitals, and relate to them the way in which a national single-payer healthcare system would save their hospital and assure healthcare for their community? So that's the idea, and we're looking for people to help us to put meat on the bones and figure out how it might be possible to do this.
Judy, that's great. That's great. Thank you, Kay. I think we are pretty much on time, and we can have people raise their hands and ask questions. Really, what we would love is for people on the call tonight to start to work on one of these 4 campaigns that we've talked about. So, but let's ask people for their comments, their ideas, questions now.
And one more thing, before commenting on the campaigns, Anna did a great study of the origins of the support for the Day of Action, and found there were more groups that were not healthcare activist groups who supported us. And we were really curious as to how those groups found out about the action and were able to endorse our statement and get activated to do it. So if people have follow up on how that happened, we would love to hear that in the comments as well. And I don't see any hands raised so far. Marty, can I put you on the spot and explain that thing that you put in the chat about Mad as Hell doctors?
Sure. I was looking for the little hands thing. I'm
Oh,
having technical problems here. Yeah. Well, before when there was during the Obama administration when the activity was being generated to pass something before the
right.
Patient Protection and so-called Affordable Care Act. Um, there was so much activism, and one of the I think more successful activities was this caravan that the doctors did. At least I don't know how many states, but I do know about here in Washington and Oregon that they got a van and they went around to communities and showed and talked about healthcare for everyone and had material and information, and sometimes were invited to speak in churches, at community meetings, all kinds of things like that. Um, and it was very it was, and they had some really good skits, and they used very effective, I think, ways to communicate. And one of the activities that we had in Seattle was at the end of the tour. We had um, some street theater and a big rally. Anyway, it was great. But I do think that one of the problems, with um, getting involved, at least for those of us who live in urban, suburban areas, is, getting involved with rural areas is that, we're not close by. There's the problem of distance and so forth. So I do think there has to be some kind of planned outreach that does involve people going to some of those communities and actually, organizing. I also think that if there were something like a caravan, it would be great if you could put together a core of people from both rural and urban areas, because we tend to stay with the people who live near us, when we're doing that work. And to be able to do something like that would also be very refreshing and different, and maybe open up some new ways of communicating.
I think that sounds like an amazing idea. I was just, I remember hearing about them, but I wasn't involved in that. And there are all kinds of, as soon as you Google it, there's all kinds of references to them. They mentioned that they're Oregon's doctors.
Yeah,
And they won a variety of awards. It is kind of a cool idea
yeah.
if we could pull it off.
I had a question.
Oh, yeah. Let's see. Sorry. Go ahead on Hell. Then Lee, I might not have seen the order that your hands went up, but go ahead on Hell.
Yeah, I just wanted, I guess, to kind of go maybe more elemental, but about the mechanics of, let's say, this SOS. So, for example, I know when I've done lobbying, like in New York State, one technique is to go to Albany, and then you could hit a number of legislators at one time. And they have like a senior day or whatever it is, theme. So I didn't know if that's a possibility with this group to maybe go to Washington D.C. on a particular day and get more bang for the buck. Now, so my question on some of the elemental basics is, when you reach out to a congressperson, sometimes if you're a member of their congressional district, you have more sway. So I know in mine, I may not have my congressperson is Goldman, and I don't particularly think he's on the progressive end of things. But I guess I'm wondering, what strategy do you recommend in that instance? Let's say I'm with the Radical Elders, and we're located throughout we don't have a list of where folks are located. We know vaguely they're in New York and Boston and et cetera, et cetera. But do you have any suggestion in terms of the mechanics of getting the SOS? Like you could just, I can write to any congressperson, or it should be within my state, or I'm just trying to get the ball rolling if we were to go in that direction on what you recommend. And I would want to also recommend possibility of doing like where a number of us could meet in Washington, DC, possibly. Thank you.
So I can answer Anka's first question. And I think that it's much more powerful for people to be constituents and to visit their own member of Congress. That's what I would recommend. And I don't know what to say about Washington, DC. I mean, it's really far from San Francisco.
Okay, so next is Diane Stokes, then Michelle Swenson, and then Lee Stanfield.
Hi. The action we did around the single payer day of action, we went to Blue Cross Blue Shield. We had speakers that talked about the impact of the cuts and why we need single payer. And then we did skit where we had a bag of taxpayer money with a rope on each side, with the billionaires on one side and the taxpayers on the other. And we pulled the billionaires down to the ground. So then we did 3 other actions targeting Darren LaHood, who's one of the few Republicans in the House that voted for. It's one of the few Republicans in Illinois. Most of them are Democrats. So he voted for the cuts. He's totally avoided the public. We went to 3 different offices. We did an action with some of the disability rights. People refused to leave. We called the staff and they called us violent monsters because we were chanting outside the office. So this coalition is made up of disability rights groups that will be negatively impacted by the passage of the Big Ugly Bill. SEIU Health Care Workers, Illinois Single Payer Coalition, AFSCME retirees, and number of other groups. And we mainly focused on these cuts, but we're always also trying to argue for single payer. So we appreciate the information that you're getting together around single payer and ideas. I think, also I would suggest we go back and look at the civil rights movement and how after the Civil Rights Act passed in 1964, we finally got medical coverage for people over 65 because of segregation in hospitals in the South. So we combine that discrimination against people by age with also income and race. So those are just some suggestions of what we've been doing in Chicago. So I'm just interested in more handouts, more ways to reach people around single payer. I think just to finish, the biggest argument is it's our tax money and we're being robbed. And, uh, also the history of how other countries like Canada did get single payer and the role of the unions in doing that. Thanks.
Thank you, Diane. I like the description of the tug of war. I don't think we had heard that before. And it sounds like you're saying perhaps some of the things you mentioned could be used in a slide presentation. Is that something you think people in your group would consider? You're on mute.
What really resonates with people, particularly if they're in unions or activists, or particularly activists of color, they supplement just the history of how we got civil rights and
Mm.
medical coverage. These were big fights. We need a big movement to do
Right.
that. How do we bring that movement together? How did we do that in the past? And include reproductive, and the destruction of the environment and how it impacts health. That appeals to environmentalists.
Thank you for that. Those are all really great points, and I think they can definitely be targeted and worked into, presentations like we were talking about. So good food for thought. And Michelle Swenson next.
Oh, thank you, Judy. I'm not sure the total concept of the slideshow for the website that you're talking about, but I wondered if it would include something about the genesis of Medicare disadvantage fraud and how it resulted in the corporate capture of Medicare and healthcare and privatization of Medicare. And, if that would be part of it. That was sort of my piece that I wrote on Common Dreams is an overview, a historical overview of the privatization or the corporate capture of, it's titled The Kleptocrats' Plunder of People's Wealth and Health. But, how we got to such a privatized state of medicine and how how Medicare has been privatized. I was just wondering if that would be part of the slideshow, or I'm not sure, if that's part of the concept or,
If I think that those would be great jumping off points, and you've done some amazing work, and I think we will. I'm not sure everybody is aware, but we will be able to work on getting some of the. You have a audio clip, and your article is something that we can make available on the website. But I take your point. I think it can be um, distilled down and used as one of the points that we would make along the lines of, stop giving our healthcare to the oligarchs and stop privatizing everything. So definitely, yes.
profiteering middlemen, yes.
Exactly. Middle after middle after middle on top of one another.
Sure, sure.
And Anna just dropped your article in the chat if people want to look at it. It's a really great synthesis that Michelle's done a lot of work on, kleptocrats. And so next is Michelle. Oh, we did Michelle. I'm sorry, Lee, and then Jerry.
I just wanted to say, when we do, I think what we need to do, I've thought about this a lot in terms of how to really get in touch with and figure out why and bring on board the people in the rural areas and the people that are being hurt the most, that really need Medicare for all the most. And I think that the best way is when we do these, I love this idea about the caravans and going out into the community, and speaking with the people person to person. And I think when we do that, we need to emphasize that we are looking to make this not just a Medicare for all, but a Medicare by all. We want their input because we want to make sure that Medicare for all is truly a healthcare system that was put together with the needs and the wants and the desires of everybody in this nation, not just the people in the halls of Congress who are writing the legislation. We want to give them feedback from the people in the rural areas who need this the most. And we want their opinions, we want their questions, we want their concerns, that we want to know what we can do to make sure that what they're needing is what we have in our bill. And we are going to be giving this feedback to the people that will be making these bills and trying to get them passed, et cetera. I think that is the crux of being able to switch this around to where we have those people on board. I really, really do. They want to be heard. They have needs and wants and desires, and they're just concerned because I think the way we lost them is that they got tired of trying to give their input and never really being heard. Just being ignored when the final bills would come out for things, whether they were from Democrats or Republicans, either one. So they gave up and then started falling for the Trump lies. But that's all I had to say.
So it sounds like almost a listening campaign in a caravan in the rural areas, which, yeah, I mean, would be amazing to do that. A heavy lift, but it would be amazing.
It is a heavy lift, but I don't think there's any other way. I think
Mhm.
we really have to win their trust back. And the only way to do that is instead of preaching to them or trying to educate them, ask for what they want and what are their needs. Then we can start, okay, well, I hear you say you want this and this and this. Okay, we will take that back and we'll talk about that. By the way, are you aware of that? And we can put a little bit of education in there, but not too much. It needs to be done in such a way that they feel more like they're being really heard. And I think that will definitely sway them to our side.
Thank you, Lee. Well, we'll start thinking about caravans. I think it would be amazing if it could happen. And then Jerry?
Yes. Lee, I really like what you're saying. We're asking them and finding their needs and how they describe the world. And then bringing in what we can do to help them. That's a great way to help people. It's just fantastic. What I was thinking about is common grounds, finding a common ground. Kay talked about going to the country, rural areas, and there's a common ground with both parties. They both need that their constituents need medical care. It's a common ground. How can we help them solve that? And I wonder if we find common ground, we don't have so much power, but they're more capable of looking at the other side. They're more capable of, let's find a solution that can help this thing we both need to solve. And I think it helps opens their minds of how we can make changes. I think sometimes when we come in as a battle like this, it closes their minds. They just block it out. And that's my experience. Thank you.
Thank you, Jerry. And I would just note that Robin Lane in the chat mentions the Down Home Carolina group, which I know participated in the actions there. Doing what Lee's suggesting, if Robin, if you wanted to talk about that, that would be great.
My computer's not cooperating very well. Can you hear me?
We can hear you. At least I can hear you.
I would just say that I think Lee's right on target. I don't think people who are hurting need to be told what's wrong. I think they need to be heard. And Down Home Carolina is working on a number of priorities, all of which intersect one with the other. Education cuts, job opportunities going to a small group of elite workers. So we need a lot of people who work in a lot of different parts of our workforce to come and tell us how they can participate. Everybody knows our healthcare system's broken. I don't think we need to go very far back into that. And it is useful to know how we got there. So I appreciate the article that you put into the chat. But yeah, we can learn. And the other thing I'd say about Down Home, North Carolina is they're very young, very, very diverse and very enthusiastic and very committed and smart.
And so the idea of the intersecting ills that that group and your group is addressing, is it happening in community forums, or can you tell us a little more about that?
I perhaps could. It gets a little complicated because what happens is leaderships of these groups, there's one in Greensboro where I live that's called Guilford for All, that supports Medicare for All, but their leadership has a commitment to hearing what people who've been marginalized in the past would say is their most pressing need. So I can name about 3 of them in my head. The names wouldn't be useful to any of the rest of you, but it seems to be a common motivation now for organizations to listen to what their membership says. So a grassroots truly rather than grass tops. And unfortunately, for some of these, there are very pressing. Our education system in North Carolina has been demolished. It's really tragic. And so teachers need Medicaid, which is really sad. And our children need Medicaid because they can't go to school when they're not healthy. So these are issues that get tangled up one in another. And the 3 groups that I have in my mind all agree with Medicare for All as a strategy, but put it as a lower priority while they work on what they see to be more pressing issues. Housing, huge.
Immediate needs are so great. Thank you so much, Robin, for sharing that. That's again really useful information, echoing Lee and Jerry.
If I could add one other thing, I'll say a few years ago, I participated in a PAC called Work for Democracy that gave funding to candidates that were aligned with priorities that the PAC identified. And again, it was a list of about 6 things. Abortion rights was very hot at the time. Education was obviously there, and healthcare. They called it universal access. I don't know that they ever truly understood single payer, but when I asked them to do the things that you put in your legislative checklist, that seemed to be too far a reach. And it turned out of 15 candidates that PAC supported, I will say after I left, 11 lost. So they concentrated on flippable seats rather than on principles and priorities. And I think that's a lesson learned. You know, if we don't have ideas that resonate with the people, they will not send them back to office. And so that checklist seems to be very smart.
It looks like Lee has her hand up.
Oh, sorry. I was just thinking, I was just processing what Robin was saying and I forgot, but yes, go ahead, Lee. Or Anna, maybe you have a comment about the.
I do have a comment about Robin's comment, and that is that it is critical that we talk about issues that impact people, and that I mean what happened in New York City, and I know it's not rural, obviously, is is an amazing example of what happens when you concentrate on what is hurting people, because people already know what's hurting them. I love that. Thank you, Robin.
So go ahead, Lee.
Yeah, I wanted to comment on what Robin said too, because she brought up this point that people have such immediate needs. One of the things that we need to also incorporate, and it is a very heavy lift, in the caravans, is not only are we listening to them, but anything you can do to help with their immediate needs, even something tiny, is just, they know you're on your side, on their side. They will remember, they'll stay more open to what you have to say when you do come back and want to tell them about Medicare for All. It's really important when somebody is facing some horrible thing immediately. They're not going to be able to hear you when you're talking about something that's long term. So if you come to, when you're on these caravan things and you come to people and you find out that there are these major immediate needs, find some way to help them with it, and it will make plenty of points for you in terms of getting them on board later.
Yes, that's an excellent point, Lee. Thank you. Okay, we have Helen, and then Kay Lasker.
Helen, can
You're
you
you're on mute, Helen.
Okay, there.
There we go.
I have heard rumblings on the internet about National Disability Week, to bring forward information. Has anybody else heard this? The needs of the disabled? Nobody else has
No.
heard
Yes.
anything about this?
I have. It's very relevant.
Was it through Move On?
I I looked at it quickly today, but I think it's a topic that is gaining momentum. It might have been even National Domestic Workers. I'm not sure.
Okay, who was speaking?
That was me, Robin.
Thank you. I'm thinking of trying to organize some kind of action around that event. Make it a little more concrete. And also, of course, oppose the Medicaid cuts, which will be devastating for the disabled community. I was just wondering if anybody else had been thinking along those lines or planning to organize along those lines.
What are the dates? Did you say it was a week?
Well, the date that's I have heard is July 26th.
Okay.
And I believe it's on a, I think that's the one that was on a Saturday.
That is a Saturday. And if you could forward any information that you might have about it to me or to Anna, that would be something that we could at least acknowledge and publicize on the website. I'm putting my email in the chat.
It's probably in a Move On
Okay,
email, and I will, if I can find it, I will send it on to you.
thank you.
There are people in Chicago that are planning to go to that. If you want, what would I do to connect them with this group or other groups that are organizing?
If you could send them to me, I would do my best to bring them into allyship.
All right, what's your email?
Helen dot Krim, Krim as in mother, @gmail.
Could you put that in the chat?
I'll put it in there.
Thanks.
And Helen, can you remind us where you are?
I'm in the Bronx in New York.
Okay,
New York
because we
City.
do have a few people here from New York, and so it would be good to connect with them.
Yes.
Helen.krim@gmail.com. I put it in the chat
Yes.
underneath mine.
Thank you.
Thank you. Kay Lasker?
Going back to the idea of the slides, when I'm in Philadelphia, we've been giving slide presentations. We often attach, pass out to the audience, or even before the event, pass out a flyer. This is not an academic type flyer. It's just like a very simple, talking points, 5 talking points, 10 talking points. Because we find that people go to one of these seminars or presentations, and then they don't remember once they leave what was the name of this, what was it they were talking about, the details. So maybe we could, and if you noticed in the asks when we were preparing for the day of action, some of the people saying, how do they get flyers? It's because some people felt they were not able to prepare them. So if we took a couple different topics or different points, viewpoints, and prepared a couple of flyers, then I think they could easily download them and make use of them.
Yeah, that's a great idea. A full circle presentation.
Mhm.
I'm just looking at, yeah, Kathy Courtney wrote about making appointments with senators and Congress on the anniversary of Medicare, 1965 to 2025. And I mean, that could be an option for thinking about the SOS campaign, I think. So thank you for that. I think that's a Texas group that you're
I
in.
think PNHP is planning to do something about that on the
Ah.
30th.
Okay.
New York PNHP.
Okay. Do we want to get some information about who might be more interested in some of the other things that we talked about, or if people have more questions about the SOS campaign? I think we had some really good thoughts about going to the people in rural areas. It's a lot to think about that and come up with a plan. And so Claire has her hand up. Please go ahead.
Yes, yes, I hope you can hear me. Regarding the SOS campaign, I think we should see if we can get some of the other organizations like PNHP and the Labor Roundtable and so on to join us in pressing our Congress people to do the special order speeches. I think we should reach out to them to see if they would be and Nurses United and all this, they would see if they'd be willing to join us in helping us press for things. Did everybody hear what I said?
Yep, yes. And I think, the key issue is we need some contacts in those organizations that are able to listen and think about doing something like that. It hasn't been easy getting leadership to sign on, and so I think we would have some work to do, but it's certainly doable. And also, Claire, did you want to share about your conversation with Summer Lee?
Oh, okay, yes. So I was down in DC today. That's why I'm on my car from, I'm on my way back. With Doctors Against Genocide. We were meeting with our congresspeople, and I met with one of the legislative aides of Congressman, my congressperson, my House Representative Summer Lee. And after myself and the other doctor with me talked about that, we both talked about single payer healthcare, and we asked the aide, would she be willing to do a special order speech about single payer healthcare, including Jayapal bill. And the aide seemed to think that was something she could definitely do, and she was going to put that on her agenda. So I will follow up with that. So I think it's an easy ask for at least some people. I think if we have a lot of people asking, and that's why I brought up having some of these other people, some of these other organizations ask. I think the more people we have asking to do that, and if we're data campaign asking that, the better the chance we get a lot of people doing that. But she definitely, the aide thought that was something she could definitely ask her to do, and that it would be a high probability that she would do it.
Well, that's great news, and not a huge surprise for Summer Lee, I think. So, I mean, it probably makes sense to target people like her first and see if anything, that somebody like Summer would do would get the ball rolling for other people. And I'm glad you were able to talk to at least her aide. It'll be a good follow-up. That's great. And thanks you must go, I think you've been going to DC about every other week, Claire, with Doctors Against Genocide.
Hold on a second. Hold on. Yes. No, I haven't been going every other week. It was once a month. We just went twice in June because of the acuteness of the situation right now.
Yeah.
With kids being starved to death. But so one of the things you'll find, usually when you call your congresspersons, and I've learned this from doing all this work with Doctors Against Genocide, when you call or go to visit, it's usually not them you're going to see. So you should ask for, when you call, you should ask to meet with or talk to their legislative director, or sometimes they call it their chief of staff, but most of them are calling it their legislative director. And that's the person who's going to go to the congressperson and push them to do things. It's my experience through Doctors Against Genocide, it's extremely rare, and talking with other people who regularly go to DC, that you actually meet with the Congress people. It's the legislative director or the chief of staff who's going to make things happen.
Well, thank you for all that you're doing. You're making inroads, I have to believe, and it's a lot of work. Anna.
You're welcome.
I echo Judy's gratitude to Claire, who's doing so much work. with Doctors Against Genocide. So what I would like to do right now, and Judy, let me know if I'm speaking out of turn, is I do want to know if there would be people that would raise their hand or say yes or speak up to join one of these campaigns to help us. So what Claire suggested about going to the leadership of NNU and the Labor Campaign for Single Payer and PNHP is, I believe that they have their set agendas and they're not necessarily going to be interested in hearing about our agenda. However, one thing that we did learn through organizing for the National Day of Action is that the local chapters are very, very willing to listen, at least the PNHP local chapters, 11 of whom endorsed, despite the fact that PNHP National didn't. So I think that is really where we need to concentrate, and to go back to those PNHP chapters and to go back to the organizations that endorsed and ask them if they would be interested in joining one of these campaigns. And particularly, I love the idea of coordinating this, as Kathy suggested, in July with Medicare's birthday. I mean, I think that this would be brilliant. Why not celebrate Medicare in the best way possible? And that is to speak out for it. So maybe that's something that we can think about. But in the meantime, I do want people to raise their hands, and I hate to put people on the spot, but here we are. So we have 4 campaigns, one of which has sort of morphed from Kay's rural hospitals to a caravan campaign, which I'm sure Kay is going to take the lead on. So because now that we finished the National Day of Action, we're sitting around twiddling our thumbs with nothing to do. So maybe let me just start with something a little bit easier than that, and that is who would be interested in working with us to let me just lower my hand, to contact their member of Congress and going over the checklist, particularly in July, to coincide with Medicare's birthday. And as I said, this is all going to be easy for you to, we have a hand up with Michelle and with Claire. This should be easy because we're going to have an action page that will be dedicated just to the SOS campaign with a checklist and so forth. So I see that Michelle, are you raising your hand to make a comment or to volunteer?
Well, I would definitely volunteer to talk to my Congress people. I also was on a phone call this week with Ro Khanna. It was called Benefits Over Billionaires. And Ro Khanna, of course, he talked about, because we asked him about, what are you going to do about Medicare disadvantage fraud? And he said, well, he a year or two ago, it was a couple of years ago, I think he helped run this bill with several other, I'm trying to remember who the other signers were, the co-sponsors, but it was, I think it was called the Save Medicare Act, but it called for renaming Medicare Advantage, saying that Medicare Advantage should not be called Medicare because it's not Medicare, so anyway, the bill, but he's definitely, I think he's very supportive of Medicare for all. So, getting people like him to sort of line up to do the SOS, is that what you call it?
Yes.
That kind of thing in Congress. Yeah, I think it would be definitely, we need to talk to our legislators about that.
Okay, great. Thank you, Michelle, for raising your hand. Other volunteers? So Jerry's signing off. Lee would love to volunteer to help make questionnaires and flyers for the caravan plan. Okay, all right. So Lee has signed up for that. Judy, you have your hand up.
For SOS.
Okay, great. Thank you.
Since I
And
live in Vermont and my senator should probably lead the way on that, right?
That's right. But you know what? Correct me if I'm wrong, but I believe that the special orders are only in the House of Representatives. Kay, do you know?
Somewhere I thought it said both, but Kay might know.
I don't know, but I've never heard of them. We did them on HR 676 in the
Yeah,
House.
yeah.
I'm not aware of them in the Senate, but I don't know the answer.
Yeah, I think it was something that we wrote up that said that, but I don't know. But anyway, my congressperson is also a supporter
That's great. That's
by
fantastic.
signature only.
And Kathy, we are going to have special orders on the website. It'll be part of the SOS page, so be on the lookout for that. And Kay, you have your hand up. Are you volunteering?
I'd volunteer for the slide program, but in relation to the visiting the Congress people here in Philadelphia, we do that every year on a Medicare birthday, and we plan on doing that this year. So we do it every year.
Fabulous. Do you think that you could add that request?
I don't follow your question.
No, add the request to make a special order speech.
Oh yeah, I'm going to do that kind of thing.
Beautiful, beautiful. That's great. That's great. Thank you, Kay. All right. So, and anyone thinking that perhaps their state would be interested in introducing a state resolution? I mean, it's a lot of work. You have to find a state legislator to champion it, usually in the House and in the Assembly. I'm actually going to try here in California. So I'll let everybody know how it goes. Are there others in the?
I think we might have had a representative in the legislature who introduced such a resolution within the last year or so, but I'm trying to recall his name. I have to think, I'll have to find out who that is.
Michelle, in which state?
In Denver, Colorado.
In Colorado.
Mm-hmm.
Yeah, let us know.
Okay.
I know that there have been some states, Kay, that have passed this in the past, but these were for HR 6.
Yeah, it was another era. We did it in Kentucky, actually. A resolution passed the House in Kentucky in probably 2007 or so. And one also passed in one of the houses in New Jersey, and I think one in New Hampshire, and maybe there were more, but it is possible in some states to do it, and it can be a way to work.
And maybe Maine also. I believe that you sent me something from the state of Maine.
Maybe.
I remember reading that one. Okay, all right, well, more on that. And how about for the rural hospitals? It looks like Lee raised her hand for that. That's going to require, obviously, a lot of thinking, planning. So I don't see Marty on the call. I don't see Marty. That's not fair.
I'll work with Lee.
Okay, that's great. That's great. I'm sure that you'll get the steering committee behind you as well. Yeah, I mean, that would obviously be a more of a long-term campaign. It wouldn't be something that we would pull off in a few months. It would be something that would take a lot of time. Claire is volunteering to work on SOS with Summer Lee, and maybe Deluzio willing to help others get their congresspersons to do one. Great, thank you, Claire. Thank you. Okay, I think that this has been super productive. Judy and Claire, do you want to take over?
Yeah, sure. Yeah, if everyone can hear me. First of all, I think this has been a lively discussion. Thank you to Anna, Judy, by leaving somebody out, Kay, for leading the discussion on plans on where we go next. And I thank all of you who came back to continue this discussion, because this is how we'll continue the work with people continuing to be involved. I encourage everyone to follow up with these plans. Remember that our is this Zoom meeting recorded? Yes. Remember, it's recorded, so you can always go back and listen to it again if you need a refresher. Also, remember our website, nationalsinglepayer.org, one word, nationalsinglepayer.org. .com, sorry. Oh my goodness. nationalsinglepayer.com, one word. And you can go to the site, all the materials you'll need. There'll be a write-up explaining how you do this. For the educationals, the teachers, there'll be slides, a slideshow produced. So you can go to that website to get the materials you need to carry out these efforts. And if you have any questions, you can put questions in there. One question that didn't come up, which I'm realizing maybe people don't know. For your congressperson, you can always go and Google their name and look for all of them have website pages that tell you how to contact them, and you can use that to contact the Congress. So our next meeting, I hope our next meeting be is it the second Wednesday of July?
Yep.
Is that correct? Or the first?
Yeah,
I
July
don't have it
9th.
in front of me.
July 9th.
July 9th, which is the second
July 9th. July 9th. That's the second. That's the second
Wednesday.
Wednesday of July. We encourage everybody to come. Yeah, I thought that's what I said. The second Wednesday of July. I encourage everybody to come back. Bring somebody with you so we can continue working on this. We're gonna have we're gonna start our webinars back again. And one of our webinars is gonna be on the model bill. But in the meantime, keep coming back so we can develop our ideas. We can help you with any snags, the problems you run into and carrying out this work. And thank you very much. We'll see you in 2 weeks, I guess that is. Okay.